So good evening, everyone. Dr. Shandrila, good evening. Okay. So we are waiting for the participants to join. So exact 4:30 or 4:35 will start because only 12 has joined till now. 12 participants only. So we had to wait for some time. Okay, Madam Shandrila, this webinar is live on YouTube. So I am sharing the YouTube link in the chat box. So kindly tell to all they can watch this on YouTube also. So this is the chat box. I copied the StreamYard link, so we can access the webinar on YouTube also. मैम खुला हुआ है, सब चालू भी कर दिए, 16 लोग ज्वाइन भी कर दिए। मैं वापस भेज रही हूँ आपको व्हाट्सएप। गुड इवनिंग। So Dr. Shandila Chillarani ma'am has joined or not? So we are waiting for her to start. Hi, Dr. Sheila. How are you? Nice to see you. Hello.
Good evening, ma'am.
Hello. Good evening.
Good evening, ma'am.
Good evening, Chandala. How are you?
Ma'am, good evening. Thank you.
I'm
fine.
I saw you. You were the one who, you are the one who has signed in so early.
Yes, ma'am.
Good to see you, Da. Hi.
Thank you, ma'am.
All the very best. Okay?
Thank you, ma'am. Thank you, ma'am.
Well, try.
Ma'am, you need to unmute, ma'am.
Okay.
Ma'am, you
Okay.
need to unmute.
Okay.
Chandani ma'am has to unmute. Ma'am, Chalrani ma'am has to unmute.
Okay. Okay. Ma'am.
Hello, good evening, ma'am.
Good evening, ma'am.
Good evening, ma'am. Madam Samta, can you unmute Chalrani ma'am?
From here I cannot. In this Google Meet. On the Zoom I can do, but on the Google Meet I cannot.
मैम को खुद को ही करना पड़ेगा अनम्यूट. मैम आप अपना ये अनम्यूट कर लीजिए प्लीज.
Dr. Chilarani, you have to unmute your phone so that we can hear your voice. It is not audible now.
मुझे लगता है बंद हो गया उनका लगता है.
She left. Okay, Sushma ma'am, this is on YouTube also, on StreamYard. I copy the link of YouTube on the chat box, so the person can see in the can join us on YouTube also.
Okay.
Good evening, ma'am.
Good evening. Dr. Chandela, what happened to her? Can you talk to her?
Good evening, ma'am.
Good evening.
नमस्ते. कैसे हो संदीप? आप संदीप ज्वाइन कर रहे हो?
Dr. Chandela,
Ma'am,
tell her to mute.
ma'am, just unmute your button. Ma'am. Red button, you unmute, ma'am.
Text her, Dr. Chandela, text her.
And please press the red button and unmute yourself. Okay. Can you hear me? Can you hear me?
Ma'am, yes, ma'am.
Okay.
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 Good evening.
All right. Shall we start?
Yes, yes.
नहीं वो चेलारानी मैम से बात कर रहे हैं. Okay. Thank you.
Ma'am.
We can start.
Yeah.
Yes, ma'am.
Shall I start?
Yes, ma'am.
Yes, ma'am. Yes, ma'am. Okay. Okay. Good evening to all of you. Good evening.
Good evening, ma'am.
Good evening, ma'am.
Good evening, all of you. Good evening, all of you. Shall I start?
Yes, ma'am. You
Yes,
can
ma'am.
start.
Okay. Okay. I'm really happy at this time to have this webinar on COVID-19. I'm really thankful to Sushma who initiated this because she suggested that we should do something on home care and all. And I was not very sure And then it was passed on to Mrs. Chandela, the secretary of SOCHNI. And I think this particular time when all of us are so much burdened with this problem of COVID-19 or coronavirus infection pandemic, which is affecting all over the world. So it is proper that as a Community Health Nurses Association, our showing that we are also aware of it and participate is something I feel is really necessary. So that way we have managed to arrange this webinar, and there are 4 speakers for it. And prior to that, I actually wanted to just introduce a little bit about what is the current situation. And I actually was saying maybe to be at a time when we all are maybe exposed to a disease, a new disease. Maybe there have been many diseases, and this particular disease, to maybe to see people around us being affected by it, and we are also restricted because of the restrictions placed because of it. So I think we have to discuss some more aspects about it. And maybe in a joking way, I did mention at the beginning of this pandemic that we as community health nurses used to go to the houses and then tell them about hand washing. I think all of you know how difficult it is to tell people you do hand washing. But I thought, a particular small virus has made the whole world to become aware of a disease like this, where without even telling, maybe or going repeatedly telling that you do, here everyone has become conscious. Everyone is learning about a disease of community health importance. And they are made to wear a mask or wear a gloves or hand washing, lot of it. So that way, I think it is something very unusual that the whole world has become aware of a community health problem. Now, currently, I was checking on what is the figures given. Today's Times of India had been giving some details of what the situation is. Information on COVID cases shows that states like Maharashtra, Uttar Pradesh, and Tamil Nadu continue to register high number of cases. While Maharashtra recorded 14,647 cases and 326 deaths in the last 24 hours, Tamil Nadu reported 5,986 cases and 116 deaths, and UP saw 4,824 cases and 95 deaths. Despite the large number of new cases, rising recoveries helped maintain the fatality rate at 1.89%, while 983 new deaths on Thursday took the death toll to 54,975. While 21.5 lakh people have recovered from the infectious disease so far, 62,282 people were discharged from hospitals or home isolation in the last 24 days. 24 hours. Around 33 states and union territories reported recovery rate of more than 50%. Delhi has the highest recovery rate of 90.10%, followed by Tamil Nadu at 83.50%, whereas states like Gujarat, Telangana, Rajasthan, West Bengal, Bihar, and Madhya Pradesh have a recovery rate of over 70%. Currently, the active case load stands at 692,028, which is 23.82% total confirmed cases so far. The focus now is on improved and effective clinical treatment in hospitals, supervised home isolation, use of non-invasive oxygen support, improved services of ambulances for ferrying patients. This led to point-to-point and efficient patient management. This is what the health ministry says. Now, I think I think all of you might have been keeping track of what is happening, especially me being in Tamil Nadu. We have seen, I mean, it was not so bad in the beginning, and now we are seeing almost every day new cases increasing. So that way it is something of concern. But then we pray that slowly this disease should be sort of go away. So that way now today's speakers, we have got very eminent speakers. So four have agreed. In that, one person did agree who is in USA. She couldn't join. So Mrs. Chandela Emmanuel has agreed to take her topic. So the topics we have selected, one is home care of COVID positive family members. This topic is going to be covered by Dr. Sushma Saini. Second one is psychological aspects of family members being COVID positive by Dr. Sheila Shenoy. Problems of children due to online classes and long duration of screen time, Dr. Samta Soni. And protection of elderly and high-risk population from COVID-19 infection by the Chandela Emmanuel. Now, before each person talks, actually, when I discussed, I was told that each person will take 15 minutes. But then before they start, I will try to introduce the speaker and they can present. Then after that, we can go on to the next topics and maybe end of it. If there is a possibility of asking some questions, we may do so. The session is from 4:30 p.m. to 6:30 p.m. Is that correct?
Yes, ma'am.
Yeah. So in that way, we will go in the same order. I would like to introduce the first speaker, Dr. Sushma Saini. I want to say very briefly about her because there will be quite a lot more. I'm sorry, I'm not going to give too much detail of her. She completed graduation in 1985 and post-graduation in 92 from College of Nursing, PGI in Chandigarh, and PhD from Chandigarh, 2006. Has 24 years of teaching experience. Presently, she works as faculty at National Institute of Nursing Education, Chandigarh. She is a member of 13 national scientific bodies. She is joint editor of Nursing and Midwifery Research Journal and member of editorial board of many reputed journals. She has presented many papers and is the invited guest faculty at local, national, and international conferences. Has 80 publications in reputed journals and is the author of many chapters in various books. Her special interest is reproductive and child health. He has guided PhD students enrolled in PhD consortium of INC and PGI Chandigarh. He is project director of Composite Target Intervention Project run by Indian Public Health Association in collaboration with State AIDS Control Society Chandigarh. So I would stop here. I invite her to talk on her topic, home care of COVID positive family members.
Thank you very much, ma'am, for nice introduction. Today the very important topic, that is home care of COVID patient, because most of the patient now are to be taken care at home. Just 1 minute. Please just give me 1 minute to share the screen. Share the screen. Just 1 minute, ma'am. I'll just share the screen.
Can I help you?
Ma'am, is my screen?
Yes, yes, yes.
Ma'am, is my screen?
Yes, visible, visible.
No, you are only visible in your small area.
Okay. Then can I start if my PPTs are visible? Can I start?
Yes, yes, this is visible now.
Okay. Thank you so much, ma'am.
Yeah.
a very important topic, home care of COVID-19. As now the government of India, they prefer that the people who do not have symptoms, they should be cared at home. But what precautions are to be taken while the home care? The first of all, who can be cared at home? These are the asymptomatic individual who are very mild to mild cases. Who,
Not
yes,
coming.
screen is not visible.
Not coming.
visible है
Visible है?
सुषमा मैम visible है चलने दीजिए
Okay. So who have fever or upper respiratory infections,
Now it's all
and
right.
if they have facility, they can be cured at home with home isolation. And if they don't have facilities in the home, then they can be cured at COVID center. Other people with moderate and severe cases, they need hospitalization and they need to be cured in hospital. But there are certain guidelines for COVID-19 which are time to time prepared by WHO, by Government of India, Ministry of Health and Family Welfare, by CDC, and there are interim guidelines for implementing home care of people who are not requiring hospitalization. And these guidelines are updated time to time, and which I am basing my presentation, that is updated on July 15, 2020. So home care for the COVID patient, first of all, we need a place where the patient should be cared. So it should be a well-ventilated single room with open windows and open door, and preferably having and bathroom attached with that room. And if there is, preferably that patient should not go in the open area of where the space where other people are sharing. But if it is important, sometime if it is required, then that like kitchen and other areas, they should be having the windows and continuous, and those windows should be open so that there is continuous ventilation. And household member, they should not stay in the same room. Preferably they should stay in different room. And if that is not possible, then at least they should maintain the distance of 1 meter at least from the sick person, and especially sleeping on the separate bed. The number of caregivers should be limited. Ideally, one person should be assigned to care for that patient, and that patient should not have any chronic sickness or any immunocompromised condition, and no visitors should be allowed till the patient is completely cured. And hand hygiene, as we know that it is very important aspect of COVID prevention. So this hand hygiene need to be performed with any type of contact with patient or immediate environment, and hand hygiene should be performed before and after doing any task of patient. And if the hands are not visibly dirty, alcohol-based hand rub can be used. If they are visibly dirty, then it should be cleaned with soap and water. And the washed hand should be dried with disposable paper towel. And if the disposable paper towel are not available, then a clean cloth towel can be used. But that towel should be replaced very frequently. And, to contain respiratory secretion, a medical mask should be provided to the patient and worn as much as possible daily, and it should be changed daily. An individual who cannot tolerate the medical mask, some respiratory conditions, they are not able to tolerate the mask, they should use rigorous respiratory hygiene, that is the mouth and nose should be covered with disposable paper tissue when coughing or sneezing, and material used to cover the mouth or nose should be discarded or cleaned appropriately for use. That is, for example, handkerchiefs that can be washed regularly with soap and detergent, and if it is disposable paper, it can be disposed into yellow bin. And use of mask is very important. Caregivers should use medical mask covering the mouth, nose, and if whenever he has to enter in patient's room, and mask should not be touched or handled during the use. If mask get wet or dirty from secretion, it should be replaced immediately with the new clean and dry mask, and remove the mask using appropriate technique that don't touch the front, but instead untie it from the back, and discard the mask immediately after use, and perform hand hygiene. And it should be in the yellow bin only, it should be discarded. And whenever you need to handle the body fluid, avoid direct contact with body fluid, particularly oral and respiratory secretions and stool. Use disposable gloves and masks when providing oral or respiratory care. When handling stool, urine, or other waste, perform hand hygiene before and after removing gloves and masks, and do not reuse mask and gloves. And about linen and utensils which patient use dedicated linen and eating utensil for patient, and the other people should not share those things. And these items should be cleaned with soap and water after use and maybe reused instead of discarding. And disinfection, this should be very frequently, like daily clean and disinfect the surfaces frequently touched in room where patient is cared for, such as bedside tables, bed frame, other bed furnitures, and regular household soap and detergent can be used to clean all these things. And after rinsing with regular household detergent, then it can be cleaned with a solution 0.1 sodium hypochlorite. And disinfecting bathroom and toilet, it can also be cleaned with disinfect. Toilet surfaces and the bathroom can be disinfected at least once daily, and regular household soap or detergent should be used first for cleaning, and then after rinsing, regular household disinfectant containing 0.1% sodium hypochlorite should be applied so that they get disinfectant. And for the laundry, clean patient's clothes, bed linen, and towel using regular laundry soap or water. Machine wash up at 60 to 90 degrees centigrade is recommended with common household detergent and dry thoroughly. Place contaminated linen into separate laundry bag and don't shake the soiled linen. And avoid contacting contaminated material with skin and the clothes. Then the person who is caring the patient, he need to use appropriate protective equipment like gloves and protective clothing like plastic apron should be used when the person is cleaning the surface, handling the clothing, and clothing or linen soiled with body fluids. And depending upon the context, either utility or single use gloves can be used. And after use, utility gloves should be cleaned with soap and water and decontaminated with 0.1 sodium hypochlorite solution. And single-use gloves should be discarded after use. Perform hand hygiene before putting on and after removing the gloves. And the waste which is generated, the gloves, mask, and other waste generated during the home care should be placed into waste bin with a lid in a patient's room before disposing it into the infectious waste. And duty of disposal of infectious waste reside with local sanitary authority. And what to be avoid during home care? Avoid other type of exposure to contaminated items from patient's immediate environment. Like don't share toothbrush, cigarette, beedi, hookahs, eating utensil, dishes, drinking water, wash clothes, or bed linen. These all things should not be shared with the patient. And the healthcare provider, sometimes the families, they hire the healthcare providers for hiring home care to the patient. In that case, if the healthcare provider provides the home care, they should perform a risk assessment to select an appropriate personal protective equipment and follow the recommendations for droplet and contact precautions. Like inpatient facility, like home, target personnel are healthcare professionals and activities. They may be providing direct care to or the assistance to the COVID-19 patient, and they use medical mask, gown, gloves, and eye protection. And diet is, since the person feels very weak and sick when the person is having the COVID infection, so they must eat healthy diet. Like they should add variety of food, including fruits and vegetables. Every day they eat mix of whole grain, legumes, fresh food, vegetables, some foods from animal sources like meat, fish, eggs, and milk. For snacks, they may choose raw vegetable, fresh fruits, or unsalted nuts. Limit salt intake up to 5 grams daily. Eat moderate amount of fats and oil. Limit sugar intake. Stay hydrated. Drink lot of water. Avoid hazardous and harmful alcohol use. And if there are small babies, then they should be breastfed regularly. And for the laboratory test, for mild laboratory, for the mild laboratory confirmed patients who are cured at home to be released from the home isolation cases must be tested negative using PCR testing twice from samples collected at least 24 hours apart. And where testing is not possible, WHO recommends that confirmed patients remain isolated for an additional 2 weeks after the symptoms resolve. And the waste management, the routine waste which is generated from patient, that should be cared as general waste and need to be disposed of as this waste management rule 2016. And the waste which is particularly generated by the home care of COVID-19 patients, it should be considered as biomedical waste and should be collected separately in a yellow bag, and same shall be handed over to authorized waste collection. And the waste collector should be provided with adequate PPE, and vehicle should be sanitized with sodium hypochlorite after every trip. And COVID-19 waste should be disposed of or the incinerated immediately once it is disposed of. And when the person is placed at home care, so it is very important for him when to seek emergency medical attention. He should look for emergency warning signs, like if somebody is showing any of these signs like troubled breathing, persistent pain or pressure in the chest, any new confusion, inability to walk or stay awake, or bluish lip or face. And um, uh, and this list is not all possible symptoms. There may be many others, but any time when the person feel uncomfortable and observe a symptom which is not which was not earlier, and he feels uncomfortable with that, so he must call for medical attention at that time. And it is always preferred that the natural ventilation should be provided with the patient, and the air condition should be avoided as much as possible. And if if there is no choice and person has to use, then its filter screen should be cleaned with disinfected, and disinfected fluid with chlorine concentration with 250 ml per liter can be sprayed on them and left for 30 minutes to work. And one should create a buffer zone at home. Buffer zone means at the entrance with contaminated area and the clean area, that is home. After getting inside, you can clean your hand and with alcohol-based sanitizer, remove the clothes, then change the indoor slippers, remove mask and dispose of into sealed rubbish bin, and disinfect your hand, take shower in the bathroom and change into homeware, and then enter into the home. So that buffer zone can be created, and WHO recommends that ensure that ill patient rest, drinks plenty of water, eat nutritious food, wear mask when in same room, clean hands frequently, use dedicated utensils, towels, bed linen for care, disinfect surface touched by ill patient, and telephone the health facility if person has difficulty breathing. And contacts the people who are coming in contact following 2 days before and 14 days after the onset of symptoms. So they should be treated as contacts, and they if they are if they are contact if they are in contact with the patient within 1 meter for more than 15 minutes, if they are providing direct care to the patient, if they are staying in the same close environment and traveling in the close proximity. So they are called the contacts. And if the contacts develop symptoms, so they should notify the medical facilities nearby, and while traveling to seek care, the contact should wear mask and protective PPE, and they should avoid using public transport. An ambulance can be called where or the ill contact can be transported with the private vehicle. And the symptomatic contact should be advised to perform respiratory hygiene and hand hygiene, and stand or sit away from others as far as possible, at least 1 meter away. Any soiled surface with respiratory secretions or other body fluids should be cleaned with soap and detergent first, and then disinfectant with the regular household product containing zero point 0.5 diluted bleach solutions. And then I will not discuss with this because the other person is dealing with this and coping with the caregiving stress. And it is very important to care these high risk individuals They should not come in contact with the patient like elders and children, immunocompromised individuals, patients with chronic diseases, and people with pre-existing respiratory problems. Thank you very much. So this is what I think I have the content about the home care of COVID-19 patients.
This is a,
Yes, ma'am. Yes, ma'am, you can.
yeah, it is a very elaborate write-up about what is to be done in a home when a person is being taken care. I think we all have got lot of education or information about it, and maybe sure others, if they want to add, they can. But at the moment, should we go on to the next one?
Yes, ma'am.
Yeah. So thank you, Sushma, for your presentation.
Thank you,
So
ma'am,
we'll move on to
for giving
the
me that opportunity.
Yeah, thank you very much. Thank you. So we will go into the next topic.
सुषमा मैम स्क्रीन
by,
शेयर बंद कीजिए.
Dr.
सुषमा मैम स्क्रीन शेयर बंद
Only
कीजिए.
the sound, you know.
Yes, ma'am.
Screen. Okay. I'll stop sharing.
Yeah.
Is it okay now?
Yeah, the sound. I think there is a break in sound. I don't know why it is happening, but if it can be taken care of, I don't know how you do it. So, shall I introduce the next speaker?
Yes, ma'am. You can.
Yes, ma'am.
Yeah, sure. So, the second topic is on psychological aspects of family members being COVID positive by Dr. Sheila Shanai. I want to say briefly about her. Dr. Sheila,
Dr. Sheila.
presently working.
Yeah.
Okay.
Yeah.
Yeah, ma'am.
She is presently working as principal of Malankara Orthodox Syrian Church College of Nursing in Kolangedi, Kerala. She graduated from Government College of Nursing, Calicut, and postgraduated from Government College of Nursing, Trivandrum in 1999 with second rank. She secured PhD in nursing from University of Kerala in the year 2015. She has postgraduate diploma in hospital and health management from IGNOU, certificate in health research fundamentals, biomedical research and qualitative research from NPTEL ICMR, and certificate in biostatistics from KUHAS. She has got 30 years of teaching experience in nursing. She has organized national, international conferences and workshops. She has published 16 scientific research articles in various journals, including Scopus Index Journal. She has been a resource person for various conferences organized by various institutions. She is also one of the vice presidents of SOCHNI. She is a member of KNI. And she has been a member of various other associations. And she has worked as program in charge for IGNOU. She has trained nurses under DFATM project conducted by INC. She has been involved in teaching all various categories of students in her life, and also being a member of board of studies in her association in the university. So I actually feel that she is a very experienced person and she has a lot more to contribute. So I invite her to talk on psychological aspects of family members being COVID.
Good evening, all of you. Am I audible, ma'am?
Yes, you are audible.
Yes.
I would like to express my gratitude. Yeah.
You have to come to the screen, I think.
Yes, ma'am.
No,
She
the
is
main
at screen.
Okay.
Yeah. See, I am very grateful to Dr. Chelrani, ma'am, for giving me the opportunity to present today, ma'am, and all the executives of SOCHNI. So let me share my screen, ma'am.
Okay.
Yeah, carry on.
Yeah. You can see now, ma'am.
Yes. This is visible.
Yes, it is visible.
So, as we all know, the COVID-19 pandemic has brought unpredictability and security to every organization in the planet, including the most fundamental unit of the society, the family. Nobody can assure when everything will be all right. So, going to the psychosocial issues of the families, I just wanted to take you, since we are community health nurse practitioners, we should know what is the intricate psychosocial relationship between the disease, healthcare providers, government, and population. See, as you all know, to combat the outbreak of COVID-19, government has set certain rules and regulations in the form of lockdown, physical distancing, and quarantine that has resulted into job loss, financial loss, and economic depression. And the population is very much impacted psychosocially. And on the other end, media has played a lot to give related updates and knowledge. At the same time, it has given misinformation, malinformation, and manipulated information, which came in the form of infodemics, again created so much of fright and panic in the population. Then what happened to the healthcare providers? They are so much victimized, actually, I should say, because they are hard working and working for the patients with COVID, and their performance, they have high performance pressure in spite of physical distress, mental distress, and stigma towards them. And the COVID-19 has incapacitated the relatives and caregivers, including the patient, because of so many problems. And this is what is happening now, what has happened now. Coming to this diagram, this is a conceptual framework showing what is the influence of a pandemic, irrespective of COVID-19 or so. What is happening to the family when a pandemic comes? So what happens? The family, all the family is disturbed, and the adjustment problems of the all family members comes in a cascading way. So here, as per the conceptual framework, there is social disruption due to COVID-19 pandemic. The caregiver is totally distressed. Caregiver may be the positive leader in the family. So the distressed caregiver has infiltrated, that affected the whole family process across the subsystems of the family and the whole family itself. If the family well-being is good, and if they are able to adapt in spite of all the pre-existing family vulnerabilities, again, it is a good signal for the family resilience. Then coming to the psychological issues noted in biological disasters, including COVID-19, this is a general view which is seen in acute phase. That is, as the disaster comes, what happens between 2 to 6 months, there is fear, denial, anxiety, insomnia, dissociative symptoms, depressive symptoms, suicidal ideas or attempts, substance withdrawal, and relapse of pre-existing mental health problems. What happens in long-term phase? There is grief, survivor's guilt, depression, substance use, relapses of pre-existing mental illness, PTSD, and somatization disorders. Then, to discuss easily, I have put the whole thing into 4 headings. That is psychological issues during home quarantine, psychological issues during hospital isolation and or quarantine, then psychological issues when a loved one dies from COVID-19, and stigma and discrimination. So what are the psychological issues during home quarantine? So the problems created during home quarantine, the family members will be distressed due to these problems. One is duration of home quarantine. Suppose like that. Then a frustration and boredom because of, I mean, once the person is in quarantine, what happens? There is lack of routine. I mean, loneliness, loss of connectedness with the world, etc. Then stigma. Stigma it will be there. You know how much stigmatized the patients are. Then again, financial issues because of job loss and financial loss. Then unavailability of supplies. There, I mean, so many people are unable to buy the supplies required for the, the disease. So, what is the general advice for coping you will be doing? One thing is altruism is better than compulsion. It means, make the family member understand that you are sacrificing for the other person. You are sacrificing for the family member. So it will be good that you should be in quarantine. Then maintaining healthy lives in terms of good food, exercise, yoga, and so much of things. Then high prevalence of psychological distress in healthcare staff itself. If the family member is healthcare staff, she or he may have be in guilt because her absence will create so much of overload for the colleagues. So, support from the management, hospital administration will be very much important in this case. Then when to consult the mental health professional? See, if somebody is asking when to consult a mental health professional, means if all the distresses, all the stress, anxiety, depression, everything is becoming more and more. If the person is not able to sleep, then they have to consult the mental health professionals. Then, what are the psychological issues during hospital isolation or quarantine? So you can divide psychological issues into two. One is new onset of mental health problems and exacerbation of pre-existing mental health problems. So what are the new onset mental health problems? Because the person may not be totally healthy, but all the problems are related to the illness. So health-related anxiety, depression and anxiety in severe cases, then low mood, fear, nervousness, irritability, anger, frustration, boredom, emotional exhaustion, feeling stress, numbness and insomnia. These may be minor, but you have to address it if it is required. Then substance withdrawal. See, non-availability of substance. If in case of alcohol, definitely there will be substance withdrawal. Then end of life crisis. If the person who was normal during the earlier days getting more and more sick, then the person will the family members will end up in end of life crisis. Then PTSD. Then some people have reported resilience, positive thinking that they will recover. This is not grave as we think of. Then coming to the exacerbation of pre-existing mental health problems, that may be exaggerated, like psychosis, mood disorders, anxiety spectrum disorders, and sleep disorders due to illus-related, stopping ongoing psychotropic drugs and drug adverse effects. Then how to manage these psychosocial issues? The first thing is what you have to do is validation. Acknowledge the feelings of the family member. Why? The person may express the feelings of sadness, anxiety, depression, fear, etc., etc. So you have to acknowledge it properly and make them understand why it is so, and this is temporary. Once the COVID goes, you will become normal, and you should be resilient enough to overcome all these things. Then keep quarantine as short as possible and stick to the recommended period. Yes, definitely you have to do that. Then provide as much information as possible about the infection and rationale behind the quarantine. If you are explaining the rationale behind the quarantine, they will be satisfied. Then you have to avoid speculations and break the chain of rumor during the hospital quarantine. Then screen for pre-existing medical, psychiatric, and substance use disorder conditions. Then you have to provide facilities to the individual to remain physically active and mentally active, provide access to family and friends through mobile phones, teach coping strategies to people who have psychological issues, ensure adequate supply of basic needs to protect the individual's safety and privacy. And this is very important, use psychotropic drugs sparingly, because so many people will do, in spite of that. This is a temporary issue, so you have to use psychotropic drugs sparingly. So the staying connected during family separation is very, very important, because the family separation creates so many issues, so many apprehensions in the family members. So remember that physical separation is necessary to keep everyone safe and healthy. Allow healthcare team to provide efficiently that is possible if family members are keeping away from the patient. Create opportunities to communicate. There are so many opportunities to communicate safely nowadays with via chat, telephone, email, video chat, etc. WhatsApp, etc. You should have important conversation. The family member should be allowed to have important conversation if health status deteriorates and prior to need for integration. This is very, very important. And the family member should understand the last wishes of the family member who is critically ill, and should provide opportunities to say goodbye. Then this is very important, helping families feel safe, because all life matters. So be supportive and give more attention, encourage healthy habits as already described, keep a regular routine where possible, provide information in a reassuring way, teach coping skills to all children in the family, and keep the family connected. Then, as already said, there are vulnerable population in the family: children, adolescents, older adults, pregnant and postpartum women, and people with disability. So they have special needs, but in this grave time, the needs may be more or different. So you have to address his needs very specifically and urgently. Then, what are the psychological issues when a loved one dies from COVID? As you all know, this is a very painful experience. And why? Because death is unanticipated, and families are separated from their loved ones, and families are unable to grieve and memorialize their loss in ways that are religiously and culturally familiar. So you are reading newspapers, you are getting so much of news, what is happening now in India, and family members are not able to grieve properly, they are not able to understand the loss properly, they feel the death very unreal, because they are not able to take part in the funeral function, and this is a real fearful condition. And grief may be due to many reasons. Maybe the circumstances surrounding the loss of the family member will not be knowing in what circumstances the loved one lost their life, and when the news comes when the family may not be ready to receive such news. The hospital might not have given full details, so that is very that creates quite apprehension in the family, and the disease remains. What happens? What will happen to the disease remains, and what are the regarding the personal belongings that may not be quickly available, and for those who prescribe some rituals after death and absence of the body, it may cause an additional loss. So I think grief is very, very important during this period. How people express grief is influenced by the culture. It is most helpful to offer support, respect, and recognition of cultural rituals for grieving families. It is important to grieve together, even though they are unable to be together physically. You have so many platforms so that you can come together and support the family, respect the family, and recognize the family loss. And coming to the grief adaptation, actually, it is neither linear nor predictable. It can be long-term, and sometimes it will take a long time to adjust with the loss. Coming to the stigma and this discrimination, the evidence shows that stigma due to coronavirus leads to reduction in people seeking medical care or testing, reduction in people adhering to interventions including self-isolation. This can lead to cases not being reported and more people being exposed.
Dr. Sheila?
Responding to the outbreak. Yes.
Yes, kindly concise.
Yes. Yeah. So these are the do's and don'ts, and these are the negative impacts, as you all know: suicidal ideation, domestic violence, and elderly abuse and child abuse, and how to help the families to build the resilience. So the family resilience can be compared to a seesaw balance. So you have the negative outcomes and positive outcomes. To have the balance, first you have to reduce the load on the negative outcomes and load up the positive side, so that you can move the fulcrum to the positive side, so that the family can make a balance. So these are the ways how you can rejuvenate the family. These are some of the evidences that positive emotion is directly related to the family resilience. And to conclude, with compassion, resilience, and willingness to help, this may be a remarkable time of growth and strength of families. And families that flourish through this challenging time will learn to listen, understand, play, learn, laugh, and grieve together. So these are my references. Thank you very much. Thank you for listening.
Dr. Sheila Rani?
Thank you very much, Sheila. I
Thank
think
you,
this
ma'am.
is one of the very elaborate presentation, because I think you touched every area. Because yesterday I was hearing somebody mentioning about that particular maybe elderly person passed away, and the persons who were there for cremation were only one son and one more relative. So
Yeah.
it is something, very, very painful. And again, not being able to anticipate and then how to cope with this type of a sudden, news or loss. I think you have really presented very well. So
Thank you,
thank you
ma'am.
very much. We move on to the next person
Yes, ma'am.
on our list. Yeah. This is about problems of children due to online classes and long duration of screen time. We're going to be presented by Dr. Samta Soni. And I want to say, she has given a very large, big biodata of hers, and I am trying to shorten it. Um, so to talk about Samta, she actually has completed, she is currently working as assistant lecturer in Government College of Nursing in Jaipur. She has completed her basic degree and master's, then PhD from Rajasthan. She works in various capacities in hospitals and community health programs. She has membership in many associations like TNEI, Life Membership, TNEI, Society of Midwives of India, SOCHNI, and also the founder president of Society of Public Health Education, Research and Empowerment. She has conducted independent research, and she has published in various journals, and she has organized conferences, including that of SOCHNI, once in her place, and workshops. She has been teaching various categories of students and guided them in their research. She has authored 4 books. She has been a mentor, coordinator, and convener in various capacities. And so, I mean, she has organized various conferences, authored 4 nursing books. She has headed various academic committees, and and she is somebody who has other abilities also, who has their own interests. So that way, I really feel happy to introduce her and invite her to give a talk on problems of children due to online classes and long duration of.
Thank you, ma'am. Thank you, Society for Community Health Nurses of India, for inviting me as a presenter. So, I would start my presentation with this. So, this is thank you for giving me such a factful and timely topic, a problem of children due to online classes and longer screen time. So, The COVID-19 has resulted in schools shut all across the world. Globally, over 1.2 million children are out of classroom. This is according to WHO and CDC, and the result, the education has changed dramatically with a distinct rise of e-learning, whereby teaching is undertaken remotely and on digital platforms. While countries are at different points in their COVID-19 infection rates, worldwide there are currently more than 1.2 billion children in 186 countries affected by a school closure due to pandemic. The Ministry of Human Resource Development, MHRD India, recommended just 30 hours of screen time for pre-primary students, 2 classes of 45 minutes each for classes 1 to 8 and 4 classes of 45 minutes each for classes 9 to 12. With this sudden shift away from the classroom in many parts of the globe, some are wondering whether the adoption of online learning will continue to persist post-pandemic and how such a shift would impact the worldwide education market. And it is clear that this pandemic has utterly disrupted the education system that many asserts was already losing its relevance. So, before starting with the problem of online education, I would like to tell the benefits of online education. It is flexible because attending classes and courses anywhere with a computer and access to the internet, they can attend the classes anywhere from the globe. And they are accessible because online courses materials can be accessed 24 hours a day, every day. Then we can achieve and we can put in global knowledge. Students are exposed to knowledge shared by the instructors around the globe, which cannot be learned in the books or in the local schools. And the next one is students control study time. Students may not have to sit for a long period of time. Lessons can be paused when needed and notes read at will. Then the next one is chances for interaction. Online courses may be intimating than the traditional classroom setting and could help the increase student interaction around the globe. Then these are online classes are cost effective. It offers a lot of saving because there are no additional cost of transportation and accommodation. Then by the online classes, students can get better opportunity. Students are given the opportunity to choose from various schools and courses around the globe. And lastly, student-centered online classes are student-centered because every student has his or her way of learning that works for them. So, if the question is learning online as effective for those who do have access to the right technology? There is evidence that learning online can be more effective in the numbers of ways. Some research show that on average, students retain 50 to 60% more material when learning online compared to only 8 to 10% in the classroom. This is mostly due to the student being able to learn faster online. E-learning requires 40 to 60% less time to learn than in the traditional classroom setting because students can learn at their own pace, going back and rereading, skipping or accelerating through concept as they choose. On the other hand, nevertheless, the effectiveness of online learning varies amongst age group. The general consensus on children, especially younger ones, is that a structured environment is required because students are more easily distracted. So these are some pros and cons of online education. I want to show the pros are globally accessible, as I told you in the previous slide, time saver, convenient timing, widely variety of options, saves money and direct induction, while cons are drawbacks of online classes are lack of peer interaction. The participants cannot interact with each other, lack of accreditation, some programs which are running without accreditation from the particular agency, and the high distraction in the internet or technical problems may occur and need to be self-disciplined. Students, there are no supervisor in the online classes. So students or learners have to use their self-discipline to maintain the quality of the classes and lack of hands-on learning. So skill-based education is lacking in the online classes. So there are some problems. So first is motivation needs monitoring. Successful online education needs structured parental oversight in the home or daily interaction with a teacher or an extremely self-motivated student. Very often none of these scenarios exist, and this is the reason online courses have such a high dropout rate. The next one is human connection. An online class eliminates the human connection that a face-to-face in-house teaching environment provide. An online instructor cannot gauge the mood, involvement, and engagement level of her student the way she can in a traditional lecture-based classroom. An educator's ability to adapt her course material presentation according to her student's reaction is at the core of enriching learning experience. This is lost of an online class setting. Then the next problem is student motivation. Students is lack motivating in online classes because it takes a highly self-motivated and independent student to complete an online course. It is naive to assume that the student with a history in a traditional learning environment should be able to easily adjust to a more independent, isolated teaching methodology. Many students who sign up for online are not prepared for the difficulty added by the absence of face-to-face instruction interaction. Then the next problem is online learning by only tickles two human senses. Experiential learning encompasses sight, smell, or experiential or classroom learning encompasses sight, smell, touch, hearing, and taste, as well as talking and feeling also, which embed learning in the long-term memory portion of the brain. Online learning or textbook learning, the economically efficient methods of delivery are not the optimum method for deep learning because they only involve the sense of sight and possibly hearing. Knowledge gained from online learning is present in the working memory, gets dumped soon after the final examination. It never moves to long-term memory. Then the next one is children need to move. Excessive time spent sitting is not good. For many years, if I felt bad that my children were on the computer and my students were on the computer in the computer lab and in the classroom also, as much as they were playing video games and learning by reading. I thought that at least if kids went to school and students went to college, they would move around in the classroom and on the sports ground. Online kids cannot handwrite, and this is the uh, major drawback of the online education for the initial beginners. Many kids cannot handwrite anymore because of their ever increasing reliance on the keyboards. These handicapped children who use a computer all through their school years but must write high stakes examinations with paper and pencil, slowing them down tremendously. Technology create errors. Computer are machines. They cannot use discretion when they mark online examination. Learner must get the short answer exactly correct with the right characteristics, capitalization, and spacing. As their work is computer marked and the program is designed to receive only a specific prescribed response. So, with the computer checking, technology creates some errors in the evaluation of students. Poor content. This is a well-known error in the online modules and classes. Even though there is no excuses for outdated content in the digital course, they are designed by humans, and humans make errors. Factual errors, spelling errors, grammatical errors, and editing errors. And some components of learning are harder to accomplish on a screen. Unless one has a statics keyboard, it takes so many more keystrokes to write exponents, fractions, and other characteristics. It is also harder to do group and collaborative work by computer than meeting in person to discuss the project and organize the workload. Then there is a adaptability struggle also with the children with online classes. Switching from traditional classroom and face-to-face instructor training to computer-based training in a virtual classroom make the learning experience entirely different for the students in this pandemic era. Their resistance to change doesn't allow them to adapt to online learning environment, whereas it takes time for them to get accustomed to course and the method of computer-based education. And while passive listening and note taking are expected in a traditional classroom, online discussion or creating a web-based demand springing into action, students with a traditional mindset find it difficult to adapt. However, they need to accept the new learning circumstances with an open mind and heart. Some technical issues are there, likewise net availability of high speed internet. Many students are not provided with the high bandwidth and a strong internet connection that online courses require, and thus fail to catch up with their virtual classmate. And moreover, most of them live off campus and find it difficult to keep in tune with the technical requirement of the chosen course. And some of them don't even own computers and seek help in learning resources center for technical assistance. In my college, we are facing the same problem because we have uh, about 40% students from the rural area of Rajasthan. So they are not having the internet in their villages. So they are totally, we have started the online classes for them since May of this year, but they are not available at online classes, and their defense is this, madam, the net is not available, the net is not available, and we have only 2G net in our village. So computer literacy is also a problem during these online classes, although students are generally tech savvy and thus able to manage computers well. Lack of computer literacy is a major issue among students and as well as teachers also. Many of them cannot operate basic programs such as MS Word and PowerPoint and therefore are not able to handle their files. Furthermore, many students and teachers also find fixing computer problems troublesome and as they have no knowledge in this area. However, technological proficiency is a must for following online courses as it enables a student to manage their assignments and courseware in an organized manner without struggling. Time management is the more and one big problem in the online classes. It is difficult task for e-learners as online courses require a lot of time and intensive work. Furthermore, whereas it is mostly adults who prefer web-based learning program for their place and time flexibility, they rarely have the time to take the courses due to their various everyday commitments. Then self-motivation is an e-learning essential requirement. However, many online learners lack it much to their surprise. After enrolling in distance learning courses, many learners fall behind and nurture the idea of giving up. As difficulty in handling the technological medium also seem unsurmountable. And students need to find the motivation to follow new education trends and also properly equip themselves for future challenges in their education and careers. So then in the next part of this presentation, we will discuss the effects of longer screen time. The more screen time is equal to more weight. As little as 2 hours of TV a day can increase the risk of weight gain, diabetes, and heart disease in adults. There are likely several factors to blame, including a sedentary lifestyle, less sleep, and generally bad eating habits when it goes into screen. Then next problem is vision issues. Looking at a screen for extended periods of time can cause computer vision syndrome. The syndrome is strained dry eyes, blurred vision, and headache. Chronic neck and back pain, poor posture when using screen or computer screen combined with can cause chronic neck, shoulder, and back pain. Poor sleep is the next problem with the longer screen time. Study link heavy computer and smartphone used to increase sleeping issues. The blue light from digital devices suppresses the sleep promoting hormone melatonin, keeping us from having restful sleep. And impaired cognitive function, cognitive imaging studies have found that spending too much screen time will lead less efficient information processing. Child become less engaged in their real-time environment and so that less sensory stimulation is there. Infant and toddlers naturally learn from their environment. Physical activities ranging from crawling to walking around the house and interacting with the family members are all fundamental to their growth. In case the students or children stick on the screen, they have less physical activity, so they have less sensory stimulation also. And whilst the child is engaged on the screen time, they are in a passive state, hence they are sensory deprived. In line with this, their brain development is reduced significantly compared to those whose senses are stimulated by the real-time environment as seen in the figure below, or figure is in the last of this presentation. And too much screen time weakens communication and social skills. Speaking of stimulation, longer screen time give little or no room for communication and social skills. Obviously, they are stuck for 2 hours or more sitting on the couch. We can say couch potato also, who are sitting more than the 2 hours couch with all the images and suggestions directly implanted into their minds without their participation. This is known as the viewer's passivity. So this takes place when the young minds are subjected to the never-ending stream of images while unknowingly inhibiting their natural capability to communicate and socialize. Longer exposure to rapid image changes increases the risk of attention problem due to airtime constants. Images are jammed together in a steady stream that fracture your attention while condensing and accelerating time. Screen time is commonly associated with the childhood hyperactivity. So Dr. Paul Thomas, a board certified fellow of the American Academy of Pediatrics and one of the top pediatricians in the US, says that a variety of content is very important for a child's development, that parents need to be involved in the choice of content. Screen time increases risk of weight gain and sleep deprivation. The major concern eventually comes in when screen-based activities substitute for physical activities. Too often, children are encouraged to use technological devices rather than playing outside. And since children stay indoor for longer period of time, they are less engaged in the physical and outdoor activities. Lack of physical exercise can be factor in weight gain, and the blue light rays. Again, I am saying that blue rays from the screen-based devices also affect their sleep-wake cycle. So negative impact, some more negative impact are obesity, sleep disturbance, bullying or other behavior problem, and academic problem, and propensity for violence. So when children are inactive, staring at their screens, they are not burning calories. This sedentary lifestyle can cause them to gain weight. Sleep disturbance, looking at a screen before bed can disrupt sleep cycle. The blue light from those screens interfere with the brain sleep cycle and can cause insomnia. Children who spend over 2 hours per day on their screens often have attention problems. Too much TV watching has also been linked to bullying. And children who spend too much time on their screen have also been shown to rose on academic testing. And we can see that this generation of students is Google-based generation. Many times they write in the references or bibliography google.com. So they are Google-based generation, and everything they are going to, they're never asking anything to them. They go to Google and search and tell to us that this is written, this is be found, or this thing on the Google. Children who are exposed to violent media such as movies, music, videos, games can become desensitized to violence. They may imitate what they see on TV or even try to use violence to solve their problem. So these are advantage and disadvantage of online classes in the comprehensive manner. Advantages are again flexibility, appropriateness, anonymity, individual attention, student-centered learning, and accessibility. Disadvantages are quality concern, minimal socializing, internet connection problem, and computer skills, dishonesty, minimal supervision, future challenges. So, in the last, I want to tell you that Government of India initiative about Pragyata, guidelines for digital education and online modules and classes and e-learning. Government of India set Pragyata. In the Pragyata, Government of India mentioned some safety measures for the parents and students for their well-being and healthy learning. So parents may interact with children on a regular basis to know their physical and mental well-being. Watch out for signs of anxiety, depression, anger during digital learning. Check if your child is becoming very secretive about his or her online activities. For example, not talking to you, deleting history of internet browser, using encryption software, and quickly flicking the screen display when he or she sees you. It is better to talk openly about your own internet uses and encourage your child to do the same. Explain and talk about basic hygiene and healthy lifestyle practices for protection during COVID-19 using digital resources. There are plenty of digital resources, videos, animation, and booklet available in the web for the healthy and hygienic lifestyle. Then combine online time with fun-filled offline plays, game, and other activities so that there is a balance between the screen time and the concrete play time. Parents may ensure the involvement of their wards in physical activities such as yoga, exercise, etc. during break from the digital learning, and keep TV and laptop, computer, etc. in a common room, common area, and definitely out of your bedroom. This will help in restricting users' time, and you can easily keep an eye on the child's overall uses of digital devices. Develop digital rules in consultation with the children and follow it. The plan could cover things like screen-free area in home, internet safety rules, duration of watching TV,
surfing the web, etc. Talk with the children regularly to help them understand the importance of responsible use of the internet rather than scolding. Discuss with the children about etiquettes. It's converted into netiquettes like not to post hurtful messages about others, not to post photos, videos, and other information without permission of that person online. Think before posting one's photo, videos, or other data in social media and other places. Discuss and inquire if the child is spending too much time on the internet or mobile, predominantly in the instant messages, forums, and texting messages, etc. And if aware, may use parental control in devices and enable safe search in browsers while children are surfing the web. So thank you for active listening. Thank you very much. Ma'am, I finished my.
Very much. Yeah. Thank you, Samta.
Thank you, ma'am. Thank you very
I
much.
think many of us have been exposed, though personally we were not really involved, but we know our relatives and all the others, how they are struggling, keeping the children, trying to keep them occupied or even to involve them now in online education. And we have heard incidences where, or at least, what you have presented is very, very valid.
Thank you, ma'am.
And children have been pushed to even, even to the extent of committing suicide. It was told that children didn't have cell phones.
Yes, ma'am.
Smartphone for studying. That is something very sad. So one side it is something which is possible. That is the only possible way of trying to keep them occupied. But other side, it has its own problem. So thank you very much.
Thank you, ma'am. Thank you very much.
It was a very elaborately presented. So thank you very much.
Thank you.
And we'll go on to the last topic.
Yes, ma'am. Yes, ma'am.
The topic is The topic is on protection of elderly and high-risk population from COVID-19 infection by Mrs. Chandler Emmanuel. To say a few words about her, she has done her undergraduate education in 91 and PG studies MSc in 2001 in College of Nursing CMC Vellore. She has currently enrolled as PhD scholar under INC consortium. Presently, she is working as a professor in Community Nursing Department of College of Nursing CMC Vellore. Is a life member of many professional associations. Currently functioning as the secretary of SOCHNI. She is served as resource person for many workshops, seminars, panel discussions, national and international conferences. She has got publications in national and international journals. She has done research independently and as a collaborative research work. She has contributed by editing chapters in community nursing books. She is also a member of curriculum committee as well as chairperson for the Board of Nursing Education, South India Education Board of CMA. So that way it is nice that she is here to present this topic. So I invite her to present the topic.
Thank you, ma'am, for giving me an opportunity to present. At the outset, I thank society as well for giving me this opportunity. Please permit me to share the slide.
I think the screen is not opening. It's not widening. So I think they have to do something about it. And sound also, I think they have to monitor.
Yeah. Kindly share your screen. Yes, this is sharing.
Can you carry on?
Ma'am,
You are in mom.
She is trying to share the screen.
Angela, you start talking. Hello?
Ma'am, she is trying to share screen.
Yeah, the sound is not coming. Hello?
Yes, ma'am.
Yeah.
Yes, ma'am.
Not able to.
She's trying to share the
I'm
screen.
just sharing.
I'm just here just
Yes,
to
ma'am. I'm.
present now.
Can you carry on?
Yes, ma'am. I'm just sharing the screen.
Yeah. Maybe yours is on mute, I think.
Oh, ma'am.
Can I help you, Shandila ma'am?
Yes, yes.
Okay, so on the right,
Shandila is
on
not
the
there.
right side of your screen of Google Meet, this is present now.
Yeah, I'm going there.
Okay, then tap on the present now and open your PPT first. Open your PPT first.
Yes.
Okay, then share then present now. Tap on the present now and then share a window. A window. Tap on the window.
Are you able to see now?
No, ma'am.
Or ma'am, just mail. Samta will share for you.
Yeah, yeah. Just mail or WhatsApp to me. I will share.
Can you see now?
No, it's not visible.
No, it is not coming.
Now
Yes,
it
yes.
is
Now
something-
it is. Now it is visible.
Okay.
Okay.
Yeah, now it's
Good.
visible.
Right,
It
right,
is
right.
also not in the list.
Yeah, it is visible.
Right.
Visible.
Okay. Can you hear me?
Yes, ma'am. Yes, ma'am.
Yes, we can.
Okay. Okay. Good evening to all. The topic that I'm going to present is on protection of elderly and high-risk population from COVID-19
No,
infection.
you are,
Yes, ma'am.
yeah, continue.
Yes, ma'am. Yes, ma'am.
Yeah.
So we have heard a lot about COVID, and this is a special group who needs to be taken care. We as community nurses need to pay attention to. Now, who is an elderly? We know that any individual who is 8 years, 60 and above, we term them as elderly. And who are the high-risk population? Apart from the pregnant mothers with children under 5, adolescents, whom we generally refer to high risk. Other than that, in this COVID-19 disease or pandemic, who do you really refer to the high-risk population? These are the people with underlying medical conditions, those with serious heart conditions, those with chronic lung disease or moderate asthma, those who are on long-term dialysis, chronic liver disease, and immunocompromised conditions. We need to take care of these high-risk population. Now, the Times of India, I could get the statistics of June, says that 10% of India's population, about 60, contributes to 60% of COVID deaths. So you can imagine the burden that we have in protecting the elderly. And of these, there's 73% are with comorbidities. And they have also given a breakup of how the disease distribution is. Of the 10% of India's population, about 8% of them belong to 60 to 74 years. And of these, there are 38% of COVID deaths. And people who are aged more than 74 years, they contribute to 2% of the pediatric population, and the deaths that are seen are about 12%. So we can get to know what is the risk involved with elderly, with COVID infection, and what is the burden that is there, and how much of a need is there in taking care of the elderly. Now, the need for protecting the high not taken care of, and in case they are affected with COVID, their risk for hospitalization is given as this. So here you see that if a person with asthma develops the COVID, they are at 1.5 times higher. They have a higher risk of getting hospitalized and developing even the complications. People with hypertension, diabetes, and obese people with BMI more than or equal to 30 have 3 times higher chance of getting the moderate to severe COVID with running the risk of hospitalization. And a person with a chronic disease has 4 times the risk, and a person with severe obesity with a BMI more than or equal to 40, or any persons who have any of these two conditions have the risk of hospitalization 4.5 times higher, and anyone who has 3 or more conditions has 5 times the risk. So it is really important that we take care of the people who are in the high risk population, because if we are not taking care of them, definitely they will run the risk of hospitalization. And with hospitalization comes other things what we have already heard, like the psychological impact, the financial burden, the financial risks, and isolation, feelings of depression, and all that. So we need to be cautious. Now, these are the routine actions which are taken against COVID for any one of us. This is applicable to both the elderly and the high-risk population, which is wearing face masks, keeping 6 feet distance from people, and hygiene, cleaning and disinfecting. These are the routine actions which we take against COVID-19. But what are the special precautions that need to be taken by the elderly? What we need to bring as an awareness, or what we need to enforce among the elderly, is they need to be taking their regular medications as prescribed by the physician. So people who are older, 60 and above, they already may be having some underlying conditions, medical conditions for which they may be taking medicine. These medicines they have to be taking regularly, they should not stop, and they should be able to, the family members should be able to help them to make sure that they are getting a stock of medicine and they are taking these medicines regularly without fail. That is very, very important. Eating fresh vegetables and fruits rather than processed foods. This is also very, very important because the fresh fruits and vegetables will definitely add to the immunity, and it really boosts the immunity of the person. Taking vitamin C rich foods, fruits or fruit juices and high fiber diet is highly advocated. Even in the hospitals, they try to give vitamin C supplement along with the Zincovit, which is again a vitamin supplement. So natural foods can be consumed, can be encouraged. The elderly can take these foods at home. And practicing breathing exercises. Deep breathing exercises is advocated, especially when you get a fresh air. There is a natural ventilation available. You need to help them to practice this deep breathing exercises, which actually helps their lung function, and it is helpful for them to cope up with any kind of a breathing problems also. So it gives a good lung expansion and be able to fight if there is at all any COVID infection. Then keeping the throat moist by drinking plenty of water is very, very essential. And it is recommended that frequently taking warm water or even a herbal decoction. In many of the states of India, I'm sure that we are giving importance to the herbal drink. In Tamil Nadu, we have strictly been given the drink called Tavasura Kudini. It is given house to house also, and in public places, people are distributing this drink to everyone. So it is very important that the throat is being kept moist. Taking adequate rest is even more important because uh, without rest, people may be stressed up and they will be thinking, will I get, if I get, what will I do, and all that kind of thinking. So, rest will actually improve their uh, mental hygiene. So, that in turn will improve the immunity and boost the immunity. Avoiding social gatherings. It is very, very important. So nowadays there are a lot of virtual meetings also which is happening even at the family level. The people with the younger generation, they are able to organize even birthday parties like that as a virtual meetings. And these can be promoted and the elderly can be told to avoid the social gatherings. Now, what are the special precautions for the high-risk population? The points what I've told you earlier is applicable for the high-risk population group also. They also need to be taking care of themselves in terms of their diet. If there are some people like persons with chronic kidney disease, they should be able to adhere to whatever is the therapeutic diet that is being recommended. And depending on the underlying illness, they should be able to take care of themselves as in terms of the diet. Same thing as applicable to these population to stay away from people and to take their correct treatment and all that. In addition to all that, they need to be avoiding closed spaces, crowded places, and close contacts with others. Staying at home is highly recommended, and even at home, if at all there is anybody, he may be potentially suspected to be uh, having had a COVID infection. They need to stay away from them. We have heard from the other speakers, especially Dr. Sushma has given an elaborate talk on how to care for people at home, the COVID positive people. So these high-risk population, if they are there in a family where there is a COVID positive suspect or a COVID positive person, then they have to be highly careful. They should be away from them. Keeping in contact with healthcare providers. These people who are high risk, who are with serious cardiac conditions or anything, they should nowadays everybody is going in for the teleconsultation. The physicians don't mind giving their contact numbers. They even say that they will be available 24 by 7 for caring for the people. So teleconsultation is available, telemedicine is available, telepharmacy, e-pharmacy is also available nowadays. And there are a lot of volunteering agencies who are there. So they should be able to, the high-risk group should be able to get the help of these volunteers and agencies and keep in contact with the healthcare provider to get the treatment done for their underlying conditions. Avoiding triggers that may worsen symptoms, especially people who have COPD or asthma, they should be able to keep away from any triggers because COVID being a respiratory illness, they should be able to highly protect themselves from any other triggers that can worsen their respiratory symptoms. And keeping up with scheduled appointments. These people sometimes, if they are not able to get the contact of healthcare provider or they are not able to get any teleconsultation or anything, they should at least keep up with the scheduled appointments. Especially the pregnant women, if they are there they are also a high risk group. If they are given a prenatal care appointment, they should be able to keep up that. They should go on time. They should be able to get the checkup done. Same way, the high risk group, if they are supposing they are getting medicines only once in a month or once in 3 months, they shouldn't miss that appointment. If they miss, they may not be able to get their medicines in hand, and they may be skipping the medicine. And by skipping the medicine, they will be getting the risk pushed higher. So they should be able to pick up the scheduled appointments, and arrangements have to be made accordingly to prior, and they should get the help of the family members. This is in brief about what they have to do, and they should not be delaying if there is an emergency care that is required. They should not think, oh, I have been told not to move away from home, I should be staying at home so I can receive care at home. In case of emergency, definitely people should not delay. They should seek the medical help immediately, and they should be able to move out and get the needed help. These are the references, and thank you for your patient listening. And this is a skeletal framework of how we can take care of the people with elderly and high risk.
Shandila ma'am, there is a question for you.
Thank you, Chandler.
Thank
I
you.
think, did you display anything? Did you display any chart or something like that?
Slides, ma'am. Slides.
Any slide?
Yes, ma'am. I had put up the PowerPoint slides.
Any slide? Was there anything displayed?
Yes, ma'am. I had put up PowerPoint slides.
Okay. No, I was not sure whether there were any slides put on, because it was not visible, because only the face was coming, so I was not sure.
No, ma'am, slides were
okay.
visible. Ma'am, slides were visible for us.
Maybe it hasn't come to me.
Okay.
So
Okay, ma'am.
I didn't look at it, but I heard what was presented, and I'm really happy because Chandela, she is having the first-hand experience because her own son is admitted with COVID positive.
Yes, ma'am.
He is now admitted in the hospital. In spite of it, she being on quarantine, she has agreed to present this. So I'm really thankful to her, and she has done the part as the secretary, communicating to everybody. So I think that there are many who will be able to tell their first-hand experience. So I'm sure there will be much more you can add. So thank you very much, Angela, for your presentation. Thank you very much. So time is 10. Do you want to have any clarification or question?
There is one question for Shandila ma'am from the audience.
Yes.
The Sheila ma'am is asking that what is the drink you are providing to the public in Tamil Nadu? The content of that drink. So can you
Sorry?
tell us?
Or what is the question?
What is the special drink distributed in Tamil Nadu? You mentioned.
Oh, yeah. Yes,
So,
yes,
Dr. Sheila wants to know the content of that drink. Dr. Sheila wants to know.
Yes. Yes, I can just. I don't know if this is visible.
Yes,
I have.
yes. Okay, this is visible.
Yes.
But
This is
we
called
want to
as.
know the content of that drink. If you can give us the
Yes.
content. Yes.
Yes, this is. I'll just. Yeah, this is containing the pepper, ginger. There is all the spices mainly, which is there. It is all given as a chemical. The species name I will just read out: Gingiber officinate, Piper longum, aromaticum, Anislis pyrethrum, Terminalia cellula, Amoebonicus. Okay, all the spices mainly are there in this thing. This is being actually prepared by the government workers. They come to the houses. I did drink this morning and evening. They come and distribute to the home. Uh, it is nice. Since I have tasted, I can confidently say that it is a herbal drink. Slightly it is bitter, but it is good.
What is this called? Kada in the Rajasthan. We are also using, but not provided for the government. We ourselves prepare in the home for the prevention
Okay,
of that
okay.
COVID. When we went to the survey of COVID patients, as we get home, first work is this: we have to eat, drink the kada after in the mixed with the boiling water. So thank you, ma'am. Yes, you had to conclude the session now because we are running late. Chilarani, ma'am.
Yeah. Okay. Maybe to add a little bit about it, I have also had taken, but this is supposed to be a drink promoted by Siddha medicine.
Okay.
So Siddha medicine, even patients who are admitted in government hospitals, they are given this particular drink, which is a powder which is prepared by Tamil Nadu government, and then it is boiled in boiling water. They put it and try to prepare it and give. Then this is only for a particular number of days. It is not for continuously.
Okay.
It is only for 5 days, especially for those who are already exposed. So, I mean, you can read about it and you will get to know more about it. And the Tamil Nadu government management of COVID.
Just one
Any
more
other
point to add.
you want to ask?
So, so no other question in the chat box. So, no, ma'am, no question is there.
But there was just one question.
Anybody wants to ask anything more? Okay, should we wind up
Yes, ma'am.
our
Yes, ma'am.
Yes, ma'am. Yes,
Yeah.
ma'am.
only thing, one of the concerns, in all our talk, I want you to keep in mind is we are talking there about maybe only those who can afford, but there is a larger poor people, who are economically poor people. So they are going to follow what we are advising. So that is something of concern, so that you can keep in mind. So it is the first attempt under SOCHNI. We have tried, and I am very thankful for those who have come forward, and even those participants, all of you who have been attending the sessions. You can give your suggestions how to improve on it, so that we hope to have a series of other health-related matters discussed in the days to come. So I really thank all of you and wish you all the best when you go back to your places. Try to implement what has been discussed today. So thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Ma'am, I just would like to say a few words.
Yes, ma'am.
In the capacity of the secretary, I would like to also thank the president for pursuing on this matter and helping us to organize this webinar. My special thanks to Dr. Sushma and Dr. Samta. Dr. Samta has been the technical support for this
Thank you.
webinar.
Thank you so much.
So
Thank you.
my special thanks to them, and as resource persons also to Dr. Sheila. Can I also, being as a resource person, readily accepted the invitation. And thanks to all the participants.
Thank you, ma'am. Thank you very much. Thank you.
Thank you. Thank you so much, ma'am.
Thank you very much,
Thank you,
Sushma
ma'am.
and Samta and others. Yeah.
Thank you,
Sheila.
ma'am. Stay safe and
Thank you.
take care of your son also. Chandila, ma'am, take care of your son.
Oh, yes, yes. Thank you.
Thank you.
Ma'am, Chandrila, ma'am, how's your son?
Yeah, he's recovering. He's better, doing well today. No fever.
Okay. So, wish them speedy recovery.
Yes, thank
Okay.
you. Thank
If anything more, we will call you.
Okay. Thank you, ma'am. Thank you very much.
Thank you all very much.
Thank you so much.
Thank you, Samta.
Thank you, ma'am. Thank you.
for monitoring.
Thank you, ma'am. Thank you very much.
Some problem with the sound and picture.
Ma'am, this is the problem of networking.
That can be improved.
Thank you.
There is the sound.
Sometimes it needs the speedy network. So if we are having the low speed network, the sound is not good. Picture quality is also better.
We have done well. We have done well. So thank you. Thank you.